I'm sorry. Hello, everyone. Right, okay, it is all on. Yes, welcome, and it's lovely to have you all here for another episode. Today, we are at the Oral Pathology 360 Town Hall, and it's lovely to have everyone here. Um, Let me see. Right, okay. So, you may be wondering what's a town hall. It's basically when we get together to talk about everything that's been happening and whether everything is going on well. Uh, so, if it is your first time here, I'm Dr. Mandana Donahue, founder of Oral Pathology 360 and also the host for these weekly events that we have. Of course, the town hall we have once a month. Right. And Oral Pathology 360 is all about promoting oral pathology, oral medicine, oral radiology, basically the diagnostic sciences of dentistry, with a hope that sometime in the future, everywhere that anyone needs one of us, they can find us, they can reach us, we are accessible, and we can provide healthcare, the best of healthcare to everybody, everywhere in the world. So, what's our agenda for today? First, we have some community news. Then, we have a small wrap up of what all happened in February. Then, we have our achievements, challenges, and then and the big news, of course, which I sort of promised everybody will be there today. So, what about the community news? It's really got to do with everybody's achievement, and let's go with that. And so, yes, these are all the people who became top performers in February by being amongst the first five to solve the weekly puzzles. Dr. H. Prasad, Dr. Tamiz Pawai, Dr. Pooja Shri RV, Dr. M. Pavitra, Dr. Shruti Murli, Dr. Upma Tomar, Dr. Yamuna Devi, Dr. Nandini, and Dr. Carla Maria Carvalho. Of course, some of them have solved it more than once. I just did not repeat the names. Now, you may be wondering, sorry, why did we jump? Okay, so can you become a top performer too? Let me just put this in the middle of the news and achievements. So you know that basically you need to solve the weekly puzzle uh, and be amongst the first five to solve it. So it's very important that you get down to solving it fast, which means you should be aware that normally every Wednesday or Thursday the new puzzle comes out, and you need to be able to go to our website and be among the first to solve it. Once you do solve it, you need to take a screenshot, and there's a link below each puzzle which says submit your solved puzzle, and you should submit it there. Now, it is very important. I have received quite a few that are not complete, so obviously I cannot take those into consideration, and that all the answers have to be done, the answers have to be correct. So if we have a crossword, basically what happens is that if you're doing it on the computer itself or on your phone or wherever, if you're doing it digitally, basically, the answers that are correct turn green. Also, you get a tick mark next to the clue. So that tells you that you're correct. And if you're doing the word search, again, you basically in the word search, you cannot get it, you cannot do it in any way besides the correct way. It just doesn't register it. And even if you print it and then basically solve it, then we would have to, of course, check it individually, but we will do that. Essentially, just remember you need to have the properly solved, completed puzzle. Another thing is, if you don't make it to the top five, it can't be all about speed, right? So we also have what we have, of course, not given so far because we've not had that many puzzles out, is the star performer. Now, to be a star performer, you should have solved 10 puzzles correctly in any 6-month period, and you will become a star performer. So basically, even if you're not in the first five, don't worry, with time you will get to be a star performer. So just keep at it. And also, it's good to go back to the puzzles and see, because each week we give last week's solution. So just go and see. It's finally meant to be just fun and learning, so you can do that. Now coming to, okay, right, we also have had people who have created the puzzles. You may have noticed that we have some puzzles that have been, you know, done by others, and it's not my puzzles. So in which case these are four people who have submitted, and Dr. Shruti Murli has submitted two puzzles, and then we had Dr. Akshay and we have had Dr. Nivedita. So again, any of you can also submit your puzzle. It will be great if you do. All you need to do is you need to submit a collection of 12 words and clues. Any topic of interest, as long as it combines oral pathology, oral medicine, and radiology, so that nobody is left out and no one should look at the puzzle and say, what? Okay. And submit it from the contributions page. Right at the bottom of the contributions page, there is one which says contribute a word puzzle. So you can submit it from there. And no, don't worry, you don't have to make it into the puzzle. You just have to submit the words, and the clues, we make it into the puzzle in our automated setting. So that is about that. Right. And hello everybody, it's lovely to have everyone here. Yes, I have my screen taken over by this PowerPoint. So, but do put in any thoughts you have. If anything you want to say in the middle, we will pause for that. So from here now, let's go to our report for February. First and foremost, of course, you may have noticed and you may have already heard, we went on to become a brand channel. Now, why is this important? Well, it's a part of the continuity program that we're putting in place for Oral Pathology 360. Eventually, it cannot be just, going on with me. There needs to be a continuity in place. And since the Oral Pathology 360 channel initially, if you remember, it was with my name. So basically it was linked to my personal account, which means obviously I cannot share my personal account with anyone else. So this way, by having it as a brand, we can just have other managers and others to take care, and eventually it can pass on and continue. So that was one thing we did. And also, it was a little scary because there was a possibility of losing everything, and that's a lot of work to lose, and not just my work. I mean, think of the volume of lectures, and I don't even want to think about it. Luckily, it didn't happen. Of course, it took hours of studying on YouTube how to do it, but it worked. So, good. That was good. The next thing that was in February is we started our new channel. Many of you may have attended the Dental Legal Insights. And that was a virtual dental academy, so that now we have a dedicated dental channel too for topics that don't fit in the oral pathology side. And some things, of course, will be common. If you haven't gone there, please visit it. It's, of course, on YouTube, Virtual Dental Academy. Watch the lecture. There are just 1 or 2 lectures right now. And then, but if you like it and subscribe. Yes. Then continuing on with, right, we also had some achievements. So among those was that we crossed 150 uploads. Now there are over 150 videos on the channel. We have over 2,300 subscribers and over 88,000 views on the YouTube channel. So thank you so much. It is really thanks to all of you. Another thing was, I feel it was a great thing that we have now started also live on LinkedIn. I guess some of you are watching probably from LinkedIn. So that's another thing. From the IARC lecture that we had, we started live streaming to LinkedIn too. And of course, we were already live streaming to YouTube and Facebook. Although not every time will we be live streaming everywhere. Most times we will probably be live streaming only to YouTube. So, but it's a good thing to have. Then we were invited to attend the Oral Health Observatory Project 2023. That's a mouthful. Okay. This was held by FDI, Indian Dental Association, and Halion, and which is of course the health arm of GSK. It was great. They're just working on the results of a study that's been going on about how effective the oral health, the project of oral health for all has been. So it was a great thing. I was very happy to have been invited, and I have to say, I think it was because of Oral Pathology 360, of course. And we were also very happy to say that at one point, quite a few of us, at least there were 4 oral pathologists there, and we felt rather nice, as you can see in that picture. So it's good to be really there where it counts. Our biggest challenge so far and still remains is information. What I find is that information is requiring that, every time that I send emails, I send the messages, and I update everything. So it will be very nice if everybody can begin to get the information themselves. It is available in a lot of places. Of course, it goes up on every one of our channels wherever we are, and also on the website. So I really hope everyone will take that step. And I guess this is a good point to, well, segue into the news that I had to share, and also update why exactly the information is important. So, coming in the upcoming 3 months, we are going to be having to watch videos instead of live streams. So OP Tuesdays will become basically recorded videos will be released, and instead of live streams. And I guess it will be at the same time. You will be able to just go to the channel. Of course, it will be only on YouTube. It will not be anywhere else. And I assume the main thing is you're going to ask why, and also ask how this affects you. So let me go to this other screen so that I can see what's happening here. Right. Okay, so right, I have not really thought this through as to how I'm going to tell you. And the thing is that, of course, for the events to go on live, it does require me being there. And I'm going to be taking some time off because, well, I have to undergo surgery, a cardiac surgery. I have had, it's not really that big a deal. I have always known that at some point in time I may need one because I have had rheumatic heart disease since childhood. And I've had a good run so far, but it's time that before I start having symptoms, I'm right now still without any symptoms, but before having any symptoms, it's time for me to go ahead and have the surgery. And, right, okay, I'm not particularly good at sharing, but I realized that since, so many of you have supported whatever I have done for this long, and this is now no longer something that just affects me and my family and friends, and there has been so much of support without which the whole Oral Pathology 360 would not have been possible, which is why it is essential, and it was essential that I tell you what's happening. But really, it's all fine. It's not a big deal, and things will go on. We will have, I will definitely try and upload pre-recorded sessions so that they will be set to go live, or rather to premiere on Tuesdays at around the same time. I will try and cover the entire 3 months. If I will definitely try and cover the entire 3 months before I go through it. And of course, now this is where you will need to check on the information yourself, because I will not be sending those emails, and I will probably also not be doing that many posts. I will try, because in certain places like LinkedIn, for example, does not allow you to schedule a post. On Facebook and on Instagram, I should be able to schedule posts so that they are released on the same day, just to remind you all what the session is and what to attend, so that those can happen, automated, even when I'm not there. I do hope that you all will continue to attend the sessions. And so let me see, was there anything else there? Oh yeah, I have to share this one. Right, so you can stay, of course, connected, and you know where to find us. Really, I think most of you know you on YouTube. If you're on the channel already, well, all it takes to know every time there is a event or there is a video released or even a live stream later is that you subscribe to the channel and you hit the notification and say all notifications. So basically, every time there is something new on the channel, you will be notified by YouTube. If you are on Instagram or Facebook or on LinkedIn, basically you can find our page, and it is at Oral Pathology 360 on all those channels. So, and then of course you can also find everything on the website. So you just go to oralpathology360.com. On the you can see it on the home page itself, or you can see it on the events, and I think that should be it. I have also included all the links in the description of today's video for everything. So that's it. Okay, now I don't think I need to share anymore. Let me see. Sorry, this is a little more complex than usual. Okay, let's go back here. No, I don't need to share anymore, and we can just chat. So that was like going through everything at super speed. And now you can tell me what thoughts you have, any questions you have. And yes, thank you all. I'm very happy that all of you could make it today. Yes, so today we have with us Dr. Nasser, Dr. Dara, Dr. Vivek, Dr. Jos, Dr. Osmani, Dr. Vivek, Dr. Divya. Right. So, anything anyone wants to ask as to what's going to happen and how to manage? I forgot to ask if everything is working everywhere. And I have also not listened. Let's see. So, okay, yeah, they work. All right. So we are done, and and the puzzles also will go on, by the way, at least most of the time. I think probably till mid-April at least. Everything should be going on. So please go ahead and be there. And I have really a request from everybody is that please turn up. Please watch the programs that happen every week. I know it may not be as interesting when it's recorded than when it is live, but then yes, it will be great if you, because if you all don't continue to keep watching, and if you don't continue to comment and share the content, the ranking of Oral Pathology 360 in the search engines will fall. So I do hope you will keep it going. Right. Thank you everybody for wishing me a recovery. Yes, Professor Hill, what is it? I would very much like to know what has caught your attention. Yes, can we discuss a topic? Yes, perfect. Do share, please. And thank you everyone for your good wishes. Very kind. Right. So let me turn off this banner. Sometimes it can be irritating. Okay. Wow. Cool. This is an interesting one. What is the opinion on plasma cells in gingival lichen planus? Wow. Gingival lichen. I haven't thought about it. Anyone who has a thought, I will take a moment to think about it. Anyone else has a thought on this? Anyone has a thought can add? Or Professor Hill, you want to jump on here? I can send you a link and you can join here. So, would you like to do that? We have time. We have sort of finished very early. Oh, Dr. Shailaja is here and she has an answer, which hasn't reached us as yet here. Now it's here, yes. Okay, so Dr. Shailaja says it depends on chronicity of lesion. Interesting. Would their presence exclude oral lichen planus? And Dr. Nasser is saying they help T cells and macrophages indirectly. And Dr. Shailaja is saying they are not diagnostic. Very interesting. So that's very interesting. Okay. So I guess for them to be diagnostic of now my mind is coming back to oral pathology. For them to be diagnostic of lichen planus, they have to be arranged in a specific way, and if there's just inflammation, they will not have that typical arrangement. Let's see, what is this? Okay. Dr. Shailaja saying although mast cells and eosinophils play a major role in pathogenesis. Okay. And Dr. Nasser is saying, I think T cells and macrophages are main players. Right. Okay, let's see what was in Professor Hill's mind. I know that they are not regarded as diagnostic. Some are very strict. Yes. I'd still really think, I think lichen planus causes much more confusion almost than anything else, right? From being, involved or constantly considered as being one of the, variably considered as being potentially malignant, not being potentially malignant. So I think really the arrangement of the cells are there and are important. While we are on asking what thoughts we have, so there is something that I came across today. Please add to this discussion as if anyone thinks of anything, you can please add. Okay, Professor Joss has got something. Right. So would one rather call a lesion with plasma cells an OLL? What is it? Oral lichenoid lesion not otherwise specified? I'm thinking that's what you meant. Oral lichenoid. Yeah, I guess it could be lichenoid. Cool. Anyone wants to chirp in on that? Okay, Yes, Professor Hill is saying oral lichenoid lesion. Dr. Shailaja is saying no, sir. So, Shailaja, come on, what is your addition to this? Yes, she has added there. I'm sorry, there is a slight lag before it comes on this system, so I can share it. Okay, plasma cells may be part of plasma cell gingivitis with OLP. And Dr. Nasser is saying interphase mucositis and lichenoid process. Very interesting. But I think at the end of the day, finally, if it is lichen planus, it's lichen planus, right? So I'm assuming that Professor Hill is talking about when it is not lichen planus, but it is looking like it, which is why he said lichenoid. I've been rather out of touch with diagnostics, but I'm wondering if it is that original criteria of of symmetrical and all those criteria are still there. So, right. Anyone else adding? Dr. Shailaja has added something there. Lichenoid dysplasia, maybe. Okay. Yes, but would it message that the clinician needs to look for other irritants? Yes, I can imagine. Sorry, I'm just seeing this. Yes, it's a very big discussion now, beyond just texting. Maybe we'll just have, once we restart the sessions, we will have a discussion on this. And it's an interesting topic. So, yes, and the texts are limited, I think, to some 140 or 180 characters, so that's a little difficult. So, Dr. Shailaja is saying yes, and components of few toothpastes, yes. So, right. This is something we need to have a more extensive discussion on, and I understand the limitations of attempting to do this via texting. And I also understand and appreciate that it was a good gap filler. Thank you all for the effort. So, I think we are sort of done. There's a news that I want to share with everybody. You may keep this conversation going if you would want to add to it. Is this, not this morning, but maybe yesterday or possibly the day before morning, there was a news item that said that in India, the purchase of cigarettes is at the highest it's ever been. And there is a considerable increase. In fact, I posted it, I think, on LinkedIn. And also for alcohol. And this is what they say is fast-moving consumer products, consumer goods, which include things like tobacco, cigarettes, everything. It also, of course, includes things like toothpaste. So it was very interesting because, in fact, just a little while back when we were just attending that event I mentioned, the OHO event, was that the reports say that everything has reduced. So it's very interesting because obviously things have not reduced, because I think one thing we can say is that we can be fairly sure that the industrial data is quite definite and quite safe to follow. So this is a very interesting. I've always wondered instead of conducting very expensive and very lengthy, whatever clinical surveys that we do, and the asking clinical studies basically, why don't we just use the industrial data, at least about things like how much of toothpaste are people using, how much of tobacco are people using. It's a very good, very straightforward way of doing it, and gives us a better answer. So this is very interesting, and I'm just wondering if anyone knows anything about this. Right, so yeah, this is back on the previous discussion of gingivitis. We always see plasma cells in most gingival inflammatory conditions. Yes, that is true. But that may be obviously because there's a very specific kind of an inflammatory reaction that takes place, the chronic reaction. And I think in any person, the microbes or whatever the irritants would be very repeated, would be recurring in the same person. So there would be a definite reaction to it. Right. Okay. Yes, Dr. Nasser, we shall have journal clubs after we start. It seems very interesting. Even the other day I had a suggestion to have journal clubs. Okay, I think whether we should. It is 6 o'clock, and we've been here for half an hour. Any suggestions, anything else that you all want to talk about? I will appreciate if everyone who's on LinkedIn goes and leaves their thoughts on that article which I have shared, which was about the tobacco usage. It's an interesting discussion which I hope we can continue to have. Again, it will not be possible to have it here with 140 characters at the time. Yes. Right, so, okay. Does anyone have any other thoughts or queries that they want to ask about how to maybe attend the sessions or going forward, and how to manage? Is there anything? Right. I think everyone is fairly, at least the audience who's here, I think, is our regular, and that is why most are here. So that should be it, I think. And right. I have to say thank you to everybody on all the platforms that you have been watching, and it's very nice that I could have you all here. 60 countries are now on track to achieving the voluntary global target of a 30% reduction in tobacco use. True. Between 2010 and 2025. This is exactly what I mean. How on track are we? And how do we know we are on track? I was surprised to see that kind of hike. So if there is that kind of hike in tobacco usage, obviously there is not a reduction, because if you're comparing a country's own usage with obviously their own records, then I'm really wondering. I mean, everywhere we are hearing that this is successful, and I'm not questioning that there must be definitely a level of success, but I do wonder if we have better data, whether we can fine tune the steps that are being taken. And I have always felt that we are not making sufficient use of the inevitable, the industrial, because industry has to record. Their very existence depends on it. How much they're selling, where they're selling, it's something they have to do. And while, of course, you may say that, for example, the tobacco companies may not very willingly want to share their data of how much they're selling, but there are finally still records that governments keep because, indirect at least, because of the production, because of the taxes they collect on the sale. So there is always data. And it's so much easier than us taking a sample of the population and doing a study, and the sample is really never going to be possible to be large enough and representative enough. So it's really very interesting. It's something I have always felt that we should have, we should go on and start to collect data from the industry and from the government. Financial data and industrial data are things that are beyond question, so much more exact and accurate as to what is happening. So there's perhaps some other reason why it's not being used, and which I don't know about. So I would like to know if someone can enlighten me on that. That would be nice, as to why we don't use those at least as surrogate data. So that is another thing. Is I'm wondering whether the last year, the whether the whole stress of COVID has just set everything off. Another thing is that, of course, there have been a lot of loss of jobs, whether again that has caused people to either start using more, the ones who are already, say, addicted, smokers, for example, are using more just because of more stress, or is it that some who had given up have started again, or is it that we are just having a new pool of youngsters or people getting added into the smoking group? Any of those is something we need to check and find out about. I'm sure you're there on LinkedIn too, Professor Joss. Of course, I can also call you and have that conversation with you. So, okay, and let me say bye, and let me not just go on and on beyond what is required. It has been wonderful and kind of you all to be here. Please share the information with others. Please definitely, attend the premieres, because I'm setting them as a premiere, so because it's easier at that moment, and some of them even I will attend, of course. So it's a point where we can just chat and we can, sort of touch base and know what's happening. It's a common point, so it is only on YouTube, of course. It is not possible anywhere else. So please stay in touch with us and with each other, and but we'll be around. Oh, and I forgot, sorry. The conference. Any of you who have been to the website may have noticed that from the events, the conference has been taken down. So, of course, that is taken down only temporarily. And we will again set up the date going forward with all the partners. And we, of course, have a vast number of partners this year too. Very happy with that. And we will get together subsequently and set up a new date and then share the details. But the case presentation conference will definitely be there. It will just be later, right? Okay, so yes, thank you, Dr. Manusmriti. Thank you, everybody. Yes, and I do hope people will do more studies. Yes. Okay, so let's say bye-bye. Bye, everybody. Have a wonderful time. And thank you again for being with us. Definitely stay in touch. I will see you all, not directly, but I will also be in the audience in the coming week during the premiere of whatever videos we put up. Have a wonderful, wonderful time, and see you all a few months down the line.